It starts with your name. So rule number 1, keep it simple. And I'm going to highlight a couple companies that do this really well. My friends, Janelle and Matt, Cardinal Family Medicine, I think they're in Huntington, Indiana. What's the state bird in this state? Cardinal, right? And their website, their name of the company is Cardinal Family Medicine. And their website is cardinalfamilymedicine.com, right? And it says a little bit about how they do what they do or what they do. Hassle-free family medicine. Great. Next one, Gold Direct Care. This is a little bit of a play off Jeff Gold's last name. I think he did something earlier in this conference that was notable. I don't know. I wasn't there. But I heard about it. What I love about this, though, it's a super simple name, Gold Direct Care, and he tells you why they do what they do right on the front of their website. We believe, or they're saying, committed to delivering primary care as it was intended. So how do you change that into a why statement? We believe in delivering primary care as it was intended. We believe in delivering primary care as it was intended, right? And then he's telling you remember that mission, vision, values? He's telling you what he values right here. Trust, openness, investing in the doctor-patient relationship, right? When you have that background in your business plan, when you have that foundation, you can pop those things in your website and help to communicate why you're doing what you're doing with your customers. They can be subtle or they can be obvious. You can just say, here's our mission statement. Here's another great one, Holton Direct Care. Remember we're talking about names that don't suck? These are all great names. You know why? Because Vance Lassie is in Holton, Kansas. And what did he call his practice? Holton Direct Care. And he's at holtondirectcare.com, right? It's like having a doctor in the family. Another thing that he's done well is he's claimed his Facebook page, facebook.com/Holton Direct Care, right? Some nice brand synchrony among his website and his Facebook page. Here's another one. I got to meet Ben Aiken. If you haven't met him, he's an awesome guy. He's starting Avenue Health out of Asheville, North Carolina. And this is a nice, clever play on the word avenue. It's memorable. It's like Avenue, the street without the E, Avenue Health. We're here for you, right? Hassle-free care for you, when, where, and how you need it. They also claimed a LinkedIn page, linkedin.com/Avenue Health. They've claimed their Google My Business, right, which is going to help elevate them in search terms. They've claimed their Facebook page, facebook.com/Avenue Health, right? Here's another great one, named after a doctor. You know, his last name is kind of hard to spell, but he had been practicing in his community for 17 years, right? I don't know if you've met Joel Schumacher. Great guy. Instantly, you feel this connection, this bond when you talk with Joel. He's just a great guy. And it shows because he started his practice about 12 months ago, 15 months ago, I think he said. And he's already in the 500 to 600 patient range, right? Because people in his community know who he is, and he has a very strong personal brand. And that's something I'm trying to communicate with you now, is your brand, you are your brand. I'm Paul Thomas, MD, and a lot of people, so I'm Dr. Paul to my close friends and patients, or Dr. Thomas to people who haven't met me yet, but a lot of people call me Dr. Plum, right? Because I'm Plum Health DPC. So what I'm trying to say is that you are your brand, and in the mind of your patient, in the mind of your community, those two things are the same, right? So Schumacher Family Medicine. So I've given you a couple examples. I kind of like a large corporate setting, like with Avenue Health. It's kind of sleek. It's kind of got a little bit of a finesse to it. You've got some practices named after the doctor themselves. And then you've got a location-based practice, right? If you're in, let's say, Ann Arbor, Michigan, maybe you call your practice Arbor Health or something like that. You know, some location or regional tie. What you have to think about is if you want to grow just beyond yourself, maybe don't name your practice Schumacher Family Medicine, right? Or if you want to grow beyond just one town, maybe don't call it Holton, right? I have a dream of delivering this to a broader community than just in Detroit and just in Wayne County. So I named mine Plum Health so I can grow beyond that, right? So those are the things you want to think about before selecting your name. I just showed that this is how Schumacher Family Medicine looks when it searches, right? Here's another question, and here's a fun one, right? Say you want to call your clinic Apple. Apple something. I like the apple. Apple a day keeps the doctor away. It's healthy. It's round. It fits in your hand. You can take it with you. It's going to resonate with you because maybe you're in Washington State, the Apple State, and you want to pick a name. So which website would you choose? Okay, looking good. A good smattering. I like it. Okay, there is no right answer, right? But one thing you want to think about when you pick that name, right? When you pick that name, can you control the space online so that you can claim, appleclinic.com and then facebook.com/appleclinic and linkedin.com/appleclinic and instagram.com/appleclinic, etc. You want to ensure this brand synchrony so that when your patient searches you or you make a post and they find you, they find your brand and it almost feels seamless, right? So, this is what we've done. I'm Plum Health DPC, the DPC standing for Direct Primary Care, but it's never written out in full. It's always Plum Health DPC. Okay, and we've claimed these Facebook, Instagram, Twitter, LinkedIn, YouTube, etc.